My name is Courtney, and I'm going to be the dental assistant today, giving oral health care instructions and applying them by demonstrating on a patient. First, let me start off by letting you know there are two types of toothbrushes, the manual and the power. Let me start off describing and explaining the powered toothbrush. The powered toothbrush rotates up to 100 times per second, depending on the brand and model you buy. This kind of toothbrush is helpful for patients with limited motor skills such as arthritis. As a CNA for the past 4 years or so, I have noticed that patients will, when they don't have a power toothbrush, they have the manual, which is a smaller handle, will use a tennis ball, poke a hole on it, and put the tennis ball in there, which makes it easier. Unfortunately, this one has a bigger handle, making it easier to use. Children also find them fun, causing them to brush longer and better, which is always good. The power toothbrush can increase the plaque amount that is removed in braces patients. In order to buy one of these, just be sure to meet safety requirements such as Underwriters Laboratories and Northbrook. Next is the manual toothbrush. You want to be sure that the bristles are soft with even rows and rounded ends. The handle should be a lightweight, small, and fit comfortably in your patient's hand. And of course, before brushing, you will need toothpaste. It's important to select a toothpaste that contains fluoride and has the ADA seal of acceptance on it. The fluoride helps to strengthen your tooth enamel. Okay, Mr. Kudelka, for this demonstration, I'm going to use the manual toothbrush and the Bass method technique, which is the technique that cleans the sulcus area or the area right under your gum line. For this technique, a pattern needs to be formed, such as all your upper teeth and then the lowers. Don't do both at the same time. So this method includes, open your mouth for me, and I'm going to let you feel and do it, and then I'm going to have you demonstrate later. So put the bristles at a 45-degree angle right there below your gum lines, and you can brush gently in a back and forth motion or rotating as you brush. Rotating and down. Okay, and then you need to keep the bristles in contact with your teeth at all times. Never take them apart. So you're moving back and forth or in a rotary motion. Okay, and then you need to make sure you brush all areas of the mouth 15 to 20 times overlapping, meaning to never take the toothbrush from your teeth. Brush the facial and lingual sides of your teeth. The facial is the front like I'm doing now. The lingual, you need to hold the toothbrush vertically, open wide, back behind your teeth. Brush again 15 to 20 times overlapping. Never take the toothbrush off your teeth. And then for your occlusal surfaces, which is where you chew your food back on the sides, upper and bottom, you would do it in a gentle back and forth motion. Back and forth, back and forth. And then you'd move to the lower, whatever arch you weren't doing just now, you'd move to the lower and do the same thing, repeating the same steps. Okay, once you've cleaned all portions of your mouth, the upper and the lower and all portions of the teeth, it is just as important to brush the backside of your tongue, because the tongue contains bacteria that causes bad breath, and as you brush the backside of your tongue, you need to go as far back as you can without injuring yourself. You may gag, but this will subside quickly. And if you don't want to use the backside of this toothbrush, they have tongue scrapers available that work just the same way. Some people prefer the toothbrush, some people prefer the scrapers, but just as important, flossing massages the gums to prevent any bleeding or swelling. There are picks and brushes available when patients find it hard to floss with the original dental floss. So I'm going to demonstrate on you and give you a feel of what the brush is like if you were to find this difficult to use. Okay, so open wide, and it just does the same thing like a pick. If you were to go out to eat and food is in between, you're going to brush in between your teeth, get all the areas front and back, make sure to get even behind that last molar, the back side. Okay, so now I'm going to let you get a feel and do it yourself, see what it feels like. Get in between every crease. There you go. Okay, understand? Good. Okay, and then there is a finger wrap technique with dental floss that can be done. You measure it 18 to 24 inches, which is usually from the fingertips to your elbow, wrapping one end about 3/4 of an inch around your middle finger, the other end 1/4 inch around, leaving an inch to work with in between. Okay, and then you're going to hold it, your forefinger and your thumb, and you're going to put it the same as we just did the brush. You're going to go in between each tooth and the contact points, but instead of just shoving it down, you're going to do a sawing motion back and forth, back and forth. Do it into a C shape and go up and down. Same thing, up and down, saw motion, getting it in. Up and down, C section. You're going to put it in a C shape, and then go up and down between the bite and in between your contact points. Okay, same thing. Make sure to get all the way at your back molar, back side of that back molar. Again, some people find it hard to use dental floss, so they'll use the brush. Okay, after brushing and flossing your teeth, you want to be sure to set your toothbrush upright position and let it air dry. Although there are containers that many people like to use and they have holes for air to breathe through, it is much better to let your toothbrush air dry. Do not let the bristles touch other toothbrushes. You want to be sure and replace your toothbrush every 3 to 4 months due to wear. Some patients find it easier to replace their toothbrush as the seasons change. Also, there are disclosing tablets that are liquid. You chew them completely and the liquid will squish around in your mouth for 10 seconds. After you let it swish around and get all your teeth, then you will spit out and rinse your mouth twice with water. Then when you look in the mirror, be sure to look for any stained areas remaining where plaque may still be on the hard to reach places and places you may have missed when brushing or flossing. You want to be sure to go back over those and brush and floss in those areas again to be sure to get as much plaque as possible. Also, as far as your diet, sugars such as soda, candies, and bacteria create acid, which starts tooth decay. Also in the diet, there are sensible snacks such as nuts, cheese, raw fruits, and vegetables that are sensible to the teeth. Okay, Mr. Kadoka, now that we're done showing you all the techniques and things, I'm going to schedule you for a recall appointment to maintain good dental hygiene. You need to be sure to come in for recall appointments frequently to keep up the good dental hygiene. You want to set a goal, get active, commit in keeping your teeth clean to achieve your good oral care. Okay? It's important that the dental assistant be educated and know proper skills and techniques to teach their patients. They need to be sure to use positive encouragement and involve the patient in the education and the techniques that they are learning for them to be able to go home and keep up the good oral hygiene.